Adrian Smith is 60 this year, but he has already encountered one of life's toughest obstacles. He has battled myeloma, a form of blood cancer, not once, but many times. The cancer struck in 2006. He responded well to treatment, only for it to relapse after 1 year. Adrian's hopes for a prolonged remission were dashed then. This type of deadly cancer is called refractory myeloma, simply because it keeps coming back, and it does not respond to treatment of any kind.
In the beginning, he responded very well to our first-line treatment. We gave him 4 cycles of chemotherapy, followed by 1 cycle of a high-dose chemotherapy with stem cell rescue, and he was on maintenance treatment. In 2007 December, that's when the disease first came back. But unfortunately, with each treatment, he would respond for about 2 or 3 weeks, and then the disease will become resistant to the treatment. This will just go on until we almost ran out of all conventional treatment for him by May 2008.
He was also inflicted with intense pain in the bones at that time. The myeloma was attacking his skeletal structure and his bone marrow inside by eating away at it and the surrounding harder bone. As a result, the bones in the spine and ribs fractured easily.
I had back pain, which I thought was the usual reasons you get back pain. Discs moving around or something, and then it's a cancer that originates in your blood that can cause your bones to deteriorate. That was part of the shock when I was first diagnosed.
But that was not the worst news. His kidney was also at risk due to the high amount of calcium that was being released into his blood circulation at the same time. The prognosis was not good. Adrian only had an estimated 6 months more to live then.
I think he came in, late morning, with his wife. I think it was something unusual because he was sitting on a wheelchair. And then I could see that he was very quiet. He was very quiet, but composed again, which, his usual. But he said, "Yeah, sister, I'm in pain." So I say, "I know." And after the injection, we had to admit him to the ward. So there was once that I could see that, he was in such a distress.
Adrian received a clean bill of health after he went through what doctors call a highly unconventional method of treatment to tackle his refractory myeloma in July. Like this blood cancer patient, Adrian had to go through high-dose chemotherapy twice, one after another, followed by an autologous stem cell transplant. This involved the harvesting of stem cells from his own bone marrow and infusing them back into his system. The technology for this procedure has improved over the years. In the 1980s to 1990s, 20% of the patients died after developing complications, and that was after just 1 cycle of high-dose chemotherapy. That figure has since then dropped to 3% today. Processing of the bone marrow is done within 24 hours to prevent any potential contamination by outside agents. The blood goes through a system of centrifuge to separate the stem cells from the others before it is sealed up and placed into storage. Studies have proven that stem cells, when processed under such conditions, can be kept indefinitely.
Every 5 to 10 years, there will always be advancements. When transplant started in the 1960s, it was just bone marrow. Now things have gone on to peripheral blood and cord blood transplants. Now this is particularly useful for children with leukemias, because if there's a child who is say 5 or 6 years old who has got leukemia, The parents may want to have another child where you can potentially harvest the stem cells of the cord blood when the sibling is to be born.
The unconventional treatment was risky for Adrian because doing high doses of chemotherapy one after another simply meant that he would have to endure more intensive side effects in the aftermath of the treatment.
You lose your sense of taste. The taste buds in your mouth, the chemotherapy destroys them to a certain extent, and so it makes eating very difficult because nothing tastes of anything, and it's any food you have, you've got to force it down, and so eating is not pleasant the way it would normally be. I lost some weight. I suppose I lost about 6 or 7 kilos altogether.
Thankfully, Adrian was prescribed some drugs to help him curb these side effects. After spending a month being confined at home, he's finally back at work. Doctors have cleared him for normal activities, unlike a month ago when his weakened immune system rendered him helpless to potential infections like the common flu in an outside environment.
A small infection can become a big infection, and of course a big infection can become life-threatening and potentially fatal. For example, if you were to get a flu, most of us will recover within 2 or 3 days, but patients may develop into a rip-roaring pneumonia from a simple flu, and of course a pneumonia can be potentially fatal.
Myeloma is not the only type of blood cancer that can be fatal for patients. Leukemia is another. This is a common illness that affects about 400 people in Singapore yearly. It does not have any age preference. Both adults and children have been known to come down with it. Mrs. Lin is one such patient. She was diagnosed in April this year. Her symptoms of tiredness started emerging in October 2007 after she returned to Surabaya from a holiday with her family in Bali.
I 在家的时候呀，我走2、3步呀，好像这个呀心脏不能够呼吸。 而且我上楼的时候不能够，所以我觉得，为什么会这样呀？我就免血，然后，医生说我得到这个病况。
Mrs. Lin traveled from Surabaya to Jakarta, hoping that the doctors in the capital could help heal her. But the doctors advised her to come to Singapore in April to seek help instead. By then, she had serious swelling and bleeding in her gums, which prevented her from swallowing any food. She dropped 15 kilograms then.
When she first came to us, she was very frightened, and she was in despair and in a almost like hopeless situation. That's because of the bad side effects from the leukemia. The inability to eat, the bleeding gums, all this frightened her to a very desperate level.
For most leukemia patients, diagnosis comes as a shock because the symptoms, bruising and tiredness, seem almost harmless. There is nothing to tie these signs to a cancer of the blood coursing through your body. And it doesn't help that leukemia has no staging, unlike other cancers. It is either chronic or acute. With no treatment, chronic patients have much better survival chances as opposed to acute leukemia patients.
The presentation of leukemia itself is very dramatic and frightening to the patient. And people hear a lot about, white blood cells being too high, eating up, the red blood cell in the platelet. So they really sense that something serious is going on in the body. And that's why, whenever you tell someone they've got a leukemia or a blood cancer, they think that they are going to die very quickly.
But the reality is this: leukemia patients have a much better chance of cure than patients suffering from other types of cancer.
A patient with stage 4 lung cancer, the chance of a cure is practically zero. What we are doing is mainly to improve survival, which is very good these days, but the chance of a cure is still not there. Whereas leukemia, it may be very widespread right from the diagnosis, but yet they still have a chance of a cure if they respond well to chemotherapy, or if they have a donor where they can undergo a stem cell transplant.
But leukemia is still considered to be an aggressive form of blood cancer, so much so that the abnormal cells in the system can multiply to reach dangerous levels in a matter of days. For a typical patient, more than 1 billion leukemia cells can be found in the system at the time of diagnosis. This was the case for Mrs. Lin.
The white cell count was very high, much more than the normal person. A normal person's white cell count is 4 to 11,000. Her presenting white cell count was 72,000. And that's the reason why we advise her to have a bone marrow examination at that point in time. And this is the bone marrow examination showing a lot of all these abnormal cells, which are what we call leukemia cells. These are immature cells. They're so plentiful that they have actually invaded into the gums, and that's the reason why her gums are so swollen.
Although leukemia is a blood cancer, simple lab tests are not enough to ascertain the presence of the illness. As leukemia originates from the bone marrow, a biopsy is thus the best way to confirm the diagnosis. A small sample of both the marrow and the blood can be extracted in a simple outpatient procedure that lasts half an hour.
Many people tell me that, wow, the bone marrow aspiration and biopsy is very, very painful. The reality of it is that it is not. If it is done properly and carefully, in the hands of an expert, a bone marrow biopsy is actually quite painless. In actual fact, I always tell my patients in terms of a pain scale of 1 to 10, 1 being the least painful and 10 being the most painful. If we do our job right, it should be no more than in the region of about 2 to 3 points at most.
For a typical leukemia patient like Mrs. Lin, the best hope for a complete cure would be a stem cell transplant, also commonly known as a bone marrow transplant. But finding a donor is and still continues to be the most difficult part for patients, because finding the right genetic match within the family is the key, and even that might not work.
You get half your genes from your father and half from your mother, and that's the reason why parents to children will always only be half match. And you will have to find your own match within your own generation, and that depends on how many children you have. We have instances that where patients are very lucky, they have only one sibling and that sibling may match, but that is extremely rare. Most of the time you need at least 5 or 6 siblings before you have a reasonable chance of about 35–40% before you can find a match.
That's not all. The donor has to be in good health and preferably at a younger age in order to reduce the risks of potential complications after the transplant for both the donor and the recipient.
You must understand that a bone marrow transplant is not a walk in the park. We do incur a lot of side effects. There's hair loss, there is mucositis, in other words, ulcers in the mouth. You feel weak, your muscles are weak, and so on. So the fitter the individual, the better they are able to tolerate it. The older patients with underlying kidney problems, heart problems, it increases the risk involved in the transplant process.
More fluids when you have chemo.
Mrs. Lin's poor health ruled her out as a potential recipient for a bone marrow transplant. Chemotherapy was her next best option because it could kill all the cancerous cells in her bone marrow before they continued to multiply. After 3 days of treatment, the swelling in her gums went down, but it wasn't easy for her at the beginning. The dosage needed to treat her leukemia was at least 3 to 4 times that of patients suffering from other types of cancers. And because of her age, chemotherapy was also risky due to the potential complications that could arise.
It's more than what we can actually understand. A lot of suffering, I should say. I think pain, fever, bleeding, infection, but end of the day, we still need to give them chemo to keep the disease at bay and to give them a new lease of life. This period, we really need to help patients how to get through this difficult moment. We are talking about 3 to 4 weeks. Now, 3 to 4 weeks apparently not very long, but when a patient is sick, it's very tedious and it's a very long and taxing period of time. So I think patient needs to be very well prepared in this manner, like how to go through the kind of suffering, we should say discomfort and many side effects.
The support of her children was what helped Mrs. Lin to get over the most tenuous part of her life. They sold off a portion of their family assets in Surabaya to make sure that she could complete all 5 cycles of chemotherapy. Now her blood tests have come back normal and she is in remission. Mrs. Lin is an example of how a leukemia patient can still harbor hope of a complete cure despite the lack of a bone marrow transplant.
一点好像害怕了，为什么我也能够中到这个病？到了医生就跟我 chemo 了，我就看我的精神一直好，我就不怕了，就是要坚强起来了。每次回到家，一下飞机，孩子女儿都讲：“哎，妈妈，你的精神每次回来增加好，这样子我就好像很高兴这样子。”
Adrian is back for a routine blood test. When he first went into remission in August, he had to come back daily for checkups. This has now been extended to weekly intervals after the danger period has passed.
It can be, of course, reassuring if the blood tests come out correctly, but I must admit that each time I do worry that the signs are going the wrong way and are a sign of the illness coming back. So yes, they're always a bit apprehensive really about what's going on and what the results might show. This time I do feel confident because right at the moment I've completed the chemotherapy treatment and the counts are going down. So at the moment I'm quite optimistic.
The results of the blood tests are back. Adrian gets them first-hand from Dr. Teo.
Okay, but otherwise your counts are doing very well.
Oh, good.
Blood test good. Hemoglobin is stable. The white cells have gone up a little bit from 2.19.
Yeah.
Platelets has remained stable.
A low share, then it happens.
The long-term prognosis for myeloma patients like him is 5 to 8 more years of good quality living, as opposed to the original 1.5 years had he presented with cancer back in the early 1990s.
That's the reason why we see.
You could say in a way you've got no option but to hold on. I mean, what else do you do? Back to your question earlier on about the sort of long-term prognosis and survival chances and that sort of thing. I don't really want to think like that. I suppose yes. It's possible that you'll get to a situation, I'll get to a situation where I run out of options. Well, then you do. But I don't want to face that before I before I need to, if you like. I want to sort of keep thinking positively and sort of do whatever I can.
It's Mrs. Lin's turn for her blood test. This is a confirmation of her cell count after her final session of chemotherapy. She is looking forward to returning to Surabaya for a longer break to catch up with the rest of her family. The results come back positive, and Dr. Teo gives her some advice before she heads back home.
So you just need to make sure these few days is very important.
Okay.
The temperature.
Yeah.
Measure the temperature at least twice a day.
Okay.
If possible, 3 to 4 times a day.
Okay.
Anytime the temperature is more than 37.5, you know what to do?
No. Take Panadol.
No, you have to call us.
Okay.
Alright? You can take the Panadol first, but you must call us now.
Okay.
Because sometimes we are worried that the temperature may go up too high, and of course it can be dangerous.
This morning is about 3.
Actually, both of them were in rather, I was thought, rather
last night.
desperate situations. But what encouraged me for them is the willingness to fight on, their willingness to fight the disease and to even undergo treatments which potentially has a lot of side effects and complications. They were willing to push on. As long as the patient has got the will to fight, of course, there will always be hope.